Greetings. Welcome to the Wednesday morning roundtable. I am Robert Lockman, an IT consultant, and will moderate the program today. In that the membership cannot meet as normal, roundtable programs will continue through May via video. We are recording the Zoom meetings with the presenters and uploading them to the roundtable's Facebook page. So please like the page and check back for ongoing program-related content. Today's topic is COVID-19 in our community. Our panelists are Kathleen Cuddy, Public Health Director of the Cayuga County Health Department, Dr. Adam Duckett, Chief Medical Officer of East Hill Family Medical, and Karen Kuhl, Executive Director of Cayuga County Office of Tourism. Next month's topic is still being decided on. As soon as it is confirmed, we will share it on the Facebook page and send out the meeting reminders as usual. Thanks so much for tuning in. Now we'll start the presentation with the first panelist, which will be Kathleen. Kathleen, welcome to the show today.
Thank you, Robert. I'm glad to be here.
So as we're doing this, how we're going to do it is, for the people listening, is we're going to have each of the presenters provide some information, a little information about what their specialty is and how it relates to COVID-19 in the community. So at this point, I will let you take it away, Kathleen.
Okay, thank you. So I'll speak off the cuff a little bit, and if there are particular questions, we're glad to answer them. But I think that goes to one of the big aspects that public health departments are providing is information. We need to be, and we are, a source of credible information about COVID-19 for the community. People have been calling us directly. People have been checking our websites. People have been checking our social media, like our Facebook site. And we are constantly providing updates and communication to our community about what's happening currently and about things they can do to protect themselves. Now, one of the big areas of public health is to prevent disease. So clearly that is a huge focus when it comes to COVID-19 and what the public health department is doing. We're doing that in a few ways. One is to help facilitate testing. So if someone has signs or symptoms of illness, may have been exposed to someone with illness, if there are indications that they ought to be tested, we encourage them to contact their healthcare provider. If they do not have a healthcare provider, our East Hill Family Medical has actually been wonderful in stepping forward to help facilitate that. The provider will make a recommendation to the health department, and we will provide and schedule a time for testing. Now, the reason we work in this capacity through someone's healthcare provider is because we have to be judicious in our use of our supplies. We have a limited number of testing swabs. We have a limited amount of personal protective equipment for our healthcare providers. That doesn't mean we don't have it. It means we need to be judicious in its use. There are other opportunities for people to get tested if they do not work through the Cayuga County Health Department, and that is a couple of our surrounding counties will accept self-referrals. Onondaga County through the Syracuse Community Health Center, and Tompkins County through Cayuga Medical Associates is coordinating testing as well. And absolutely, residents of Cayuga County are welcome to go there as well. When someone's tested, the results take a few days to get back, but Cayuga County Health Department receives that information. If it's a negative test, we can call you and say negative. If it's a positive test, we're going to talk with you about your mandatory isolation, and that's an attempt to prevent further community spread. And as part of that, we talk to you about who you've been in contact and where you've been so that we can then quarantine people who may have been in contact with you. All of this, again, is an attempt to reduce the exposure, to limit the number of people who've been exposed to this virus. But I think it's very important to say that the virus is here in our community. It doesn't matter where the individualized diagnosed person is. As we have seen throughout our country, as we have seen throughout our state, it is everywhere. So I stress constantly the importance of the social distancing, of staying home, particularly if you're ill, stay home. contact your healthcare provider if necessary. But we cannot reinforce enough staying away from other people and out of public places at this time unless it's absolutely necessary. Um, this virus is droplet borne. We understand that it may be transmitted as much as 48 hours prior to getting your first symptom, and therefore you may not realize that you're spreading the virus. And so you really, to protect other people around you, want to limit the interactions that you have. And this goes to why we talk about staying 6 feet apart, because droplets may travel as far as 6 feet. And those droplets that emanate from a sneeze or a cough or even talking can contain the virus that is highly contagious. So we work with people who are in isolation quarantine. We continue to provide information. We continue to provide testing. We are working closely with our healthcare providers, providing updated information to them. This is a constantly evolving situation. It's so new to all of us. We're learning a lot every day, and things we did 2 weeks ago may be different in how we are moving forward with treating them currently. So those are my highlights. I guess that I just want to keep speaking to the fact that, stay home when you're ill. If you need to seek health care, please do so. Wash your hands frequently, cover your mouth. There is one more, I think what's relatively new from a few days ago is the CDC is recommending the use of masks when you are in a public area. And so because the specific N95 masks need to be used by healthcare providers and procedural masks are used by healthcare providers, you may see many people using an improvised or a homemade cloth mask. Absolutely fine. It's still something that helps reduce you emanating droplets from your mouth, which may cause other people to become infected if you carry the virus.
All right, Kathleen, thank you very much for that information. It was very, very good information for everybody out there. Is there any final thoughts that you have as far as for this portion of the cast?
I think, again, I can see the number of cases continuing upward at this point in time for upstate New York. So we do not want people to become complacent. We are in the thick of it right now. I expect it will get worse before it gets better. And please stay home, maintain your social distancing, maintain your good hygiene.
Okay, thank you very much, Kathleen. I think that's the important thing. As she mentioned, we are coming up to the thick of this and around this area. So by all means, very, very important to heed those warnings. Thank you again. Next, we will be actually speaking with Adam. Adam, welcome to the cast today. How are you doing?
I'm doing great. How are you?
I'm well, thank you.
Thank you. Well, thanks for having me on. And, following Kathleen, I mean, she brought up a lot of very good points there. So I won't really repeat some of them. Well, maybe some overlap. But, I guess a big message that I would like to send out to folks that may be listening is that it's very important right now to not obviously just follow the recommendations in the isolation, but also to take some efforts to make sure that you're prepared and that you're taking care of your other medical issues. What we're finding a lot on the medical end is that a lot of things, as we know, are getting rescheduled, procedures, elective procedures, colonoscopies, mammograms and such, and that's fine. But if you are actually having issues, if your blood sugars are too high or if you're having chest pains, you still need to go reach out to a doctor and get help. I know that a lot of people are having kind of a rush. Some are getting a rush to try to find doctors. I think where, as Kathleen was stating, that's where E-Still is coming in. I mean, 4 nights a week, we're open till 8 p.m. And we are just now instituting where we're taking new patients for a video visit initially, which means that if somebody's afraid to come in, but they need to establish care, we will do a video with them at first and then have a follow-up in 4 to 6 weeks where hopefully the idea is that everything is going to be on the decline, hopefully, right, by then. and then it would be have people more comfortable to reach out and get some help. Understand that, that video visits are everywhere. I know that not just East Hill, but many primary doctors in Auburn, the hospital, and all their groups, everybody seems to be on board with doing these video visits, but they do have their limitations. There may be times where your doctor says, listen, I physically have to lay hands on you to see what's going on. I might have to listen to your lungs. I might have to press on your belly. There's some things that you can't simply do over the video, but be assured that all these doctors' offices in the community are doing their best to screen that there are no sick folks coming into the offices, meaning that every office that I know of is asking everybody if they've had any symptoms, any fevers, chills. I know a lot of facilities such as East Hill, as well as a hospital, if you come in, you are having your temperature tested right at the door and you're being asked questions. So we're really trying to make an attempt to make sure that our staff, as well as our patients, are safe. But to the point that Kathleen stated, and I guess this is where some of the overlap comes, we're finding that people can be highly infectious, 3 days even prior before having any symptoms at all. So, I mean, that's kind of going back to the point of people, if they want to wear these cloth masks when they do go out in public, please do. Again, they do not protect you per se from, in a way an N95 mask does, but the idea is solely to prevent the spread of your own germs to other folks. So if you were to cough or sneeze, it's more so contained in your mask, and it's not spraying the 6 feet, into the room and your surroundings, or onto objects at the market or at Walmart or whatever else. So it's really trying to limit your germs from spreading to others as well. But really, I mean, I think that our community has come together very well. I think it's important for people to know that. I think that I know, again, what East Hill's doing and what we're doing, and we encourage people to reach out for help there. And like I said, that's a big one. I know that the hospital has been working literally 7 days a week, their administrative team, of expanding the capabilities of the hospital, how many patients they can see, and coming up with different plans of how to accommodate if, in fact, we see a big spike in cases that may require hospitalization. Obviously, we're going with a model here in the community with plan for the worst and hope for the best. We really don't have a good idea per se of how bad this will actually hit Cayuga County in terms of people that need hospitalizations and ventilators. But at the same time, that doesn't mean that we plan for the worst case scenario to the best of our ability. So I guess my big take homes in my introduction here is, again, don't put the rest of your healthcare on hold. If you don't have a doctor, get one. If you don't have access to a smartphone or tablet, order one or have a friend bring one and leave it on your doorstep, and so you have access. Because if you need one to communicate for a doctor's office or whatever else, you want to make sure that you're prepared. Continue, as Kathleen was saying, with the social distancing. Make sure that you're not going out needlessly. If you do go out, don't send the whole family to Wegmans. Just send one person at a time. I mean, really limit how many people are going out, and make sure that you're not going out if you're ill yourself. And I think those are really just my start points for today.
Okay, thank you very much for that, Adam. That's, again, some great information. I definitely appreciate you taking time today to speak about that. And
sure.
Now we will hear from Karen. Karen has a PowerPoint presentation that she'll also be sharing. Karen, welcome to the show today.
Thank you very much, Robert. Let's see if I can kick this off for us.
All right.
Let me know if you're viewing the presentation.
Yes, it looks good on our end.
All right, wonderful. When I titled the presentation, Tourism in the Times of COVID-19, it sounded like a horror movie to me. But sometimes it really does feel like we're living through a real life horror movie. We hear about the situations going on and it's hard to believe they're really happening, but here we are. So I wanted to start off with first things first. The two experts that we just had speaking are the ones that we listen to right now. We listen to the health professionals. We travel tomorrow. It's not what me as a profession is ever thought I would be saying, but stay home. Stay home. We can travel tomorrow, and we'll be traveling to a much safer world if we take care of ourselves and our community first. I wanted to start off with a couple of visuals of what is on the tourism sites. This is I Love New York, and this is our Tour Cayuga website. Both of them very strong messages towards COVID-19, to be careful and stay home, wash your hands. We even have sent out messages shared to our lodging partners, because all the hotels are an essential industry, but we have sent out notices to let anybody who is traveling that to treat their home, their hotel room, as their new home. This is it's supposed to be heated by everybody. A couple of numbers from the U.S. Travel Organization on the impact that this situation is having nationally. 5.9 million travel-related jobs are expected to be lost by the end of April. There's a loss of travel-generated, the loss of travel-generated jobs alone will double the unemployment rate. That is how big our industry is and the big impact this situation is having. The U.S. economy is projected to enter a protracted recession based on the unexpected downturn in travel alone. That is how much our industry and the economic impact our industry has, not only in Cayuga County, but of course in all the U.S. Travel industry losses will result in a GDP impact of $502 billion in 2020. These are big numbers. This is our number in Cayuga County. This is our 2018. This is the impact that tourism has in Cayuga County. $104.69 million generated from tourism. And it is split up more or less like this. We have our lodging, recreation, food and beverage, retail and service stations, transportation, and second homes. All of these are sectors of the tourism industry and the way our impact is measured. So the CCCVB, that is the Cayuga County Convention and Visitors Bureau, that is us. And this is our mission. This was our mission pre-COVID-19. An excerpt of our mission. It's a little longer than that. But we are intended to increase tourism and related revenues through promotion and research-based targeted marketing. And we provide the visitor experience by providing data and training to local hospitality and industry providers. Now, how has this refocused during COVID-19? We have refocused our mission to support and promote within our community to help promote the restaurants through Curbside Cayuga, our retailers through online shopping, and our attractions through a virtual calendar of events. These are different sections of our website right now. The calendar of events, as we know, all events have been canceled. But a lot of the beauty of ingenuity in the time of crisis has come through in how these attractions are still putting their material out there. Our website has the virtual calendar that tells you how you can still exercise through your favorite yoga place, how you can visit the Seward House, how you can visit the Cayuga Museum, as well as shopping, how you can still get your Tree Laven wines delivered to you, how you can, all the different retailers. And we try to focus on locally owned retailers. And then we also, of course, have our Curbside Cayuga. Curbside Cayuga has a listing of all the restaurants that are offering to-go service as well as curbside pickup service. I've tried to be very supportive. We try to go to restaurants and get takeout as periodically as we can, and everybody has been so good as far as delivery. The hands-free delivery, pay beforehand and then arrive. The health concerns have been taken very seriously and applied by everybody. Now looking at the post-COVID, we, as I started the presentation, need to heed to the health issues first. When we are allowed to be reintroduced into society and visit restaurants, our take from our office will be as slow and steady. We will not automatically jump into a big mass promotion, come back and visit us, but try to stay regional. Let people know that our restaurants have been open and they can come visit, but go like in a target, continue with our residents, and then go to our neighboring counties, and then expand to where we eventually will get statewide. And if we don't have a resurgence of the virus, then we can continue our national and international promotions like we were doing previously. The question that you asked me to answer specifically was, how best can the tourism industry related businesses bounce back? It's, as I started, a huge industry, and the impact has been immense. And honestly, the answer to this question is very simple. It's supporting. It comes from us. It comes from each one of our residents supporting our businesses. They're important to our way of life. Cayuga County is a very community-based county, and we need to be there for our businesses. If we want them to survive, we need to be there for them today, now, as well as through the entire process. But first of all, as everything, support our health services in any way we can. Stay home. Don't spread the disease so that we can continue our way of life. Support our local restaurants right now. Get takeout, get delivery. Check out our website for many of the places that are open. Support our public arts. Attend the virtual events. Donate their fundraisers. Buy gift cards. By attending their virtual events, you're showing your support. You're telling them that you're there for them through all this. Post. Follow, rate your favorite places. All the online channels are available to us right now will be the way that when visitors do come back, we'll find out about what places are available and how much you love them. If us, the residents of the area, love them, they're most likely to be loved by the visitors. Don't cancel events. Try to reschedule them. And this is the message that's being sent out industry-wide for all the conferences and all the weddings and all the events that were supposed to be happening right now. Try to reschedule them. Don't just cancel them outright. And pay it forward. Buy gift cards from local privately owned restaurants and give them out to friends, relatives, neighbors. A lot of people have lost their jobs. This is a way that you can help the businesses and help the people in need. Tip, if you can afford it, be generous. It's always appreciated, but right now it's very much needed. But most of all, like I said, be proud. That's how we can help businesses get out of the bind and get back to being productive and economically contributing to our community. This is our Cayuga, something that we're going to try to steer our promotions from here on forward is our Cayuga. Play on our name, Tour Cayuga, and be a proud neighbor, be a proud ambassador. There are many ways to do this. Our office has lots of different programs that we can support people if you want to be an ambassador, so give us a call. And that's what I've got for you, Robert. I hope it was helpful and we get the community engaged.
Very much, Karen. That's some great information. I think that a lot of times we don't realize the impact that tourism has on this industry. It's obviously quite the impact with the numbers that you produce. So definitely appreciate you sharing that information with us today.
Thank you, Robert.
Okay, so now we're going to go into our question portion of the series here. I'm going to start with some questions that we have for Kathleen, and after I ask a few of the questions that we already have set up, we will open it up to everyone here on the panels if they had any other follow-up questions that we may not have touched on. So Kathleen, the first thing that we are interested in, we had a question, is the flu and the COVID-19 symptoms are very similar. How can someone tell the difference?
It would be very difficult to tell the difference because the symptoms are so similar. So we say seek healthcare, right? Healthcare providers can often do a rapid test to identify if you may have flu or make a referral for you to get tested for COVID. Oftentimes the treatments are the same though. You're treating the symptoms. I would be remiss not to say, get your flu shot when you can in order to help prevent getting the flu in the first place. But these viruses are running concurrently and you really need to get clarity through your healthcare provider and testing.
Okay. The other one is, and we did touch on this, was about what masks. Obviously, people are doing the homemade masks, the cloth masks, and you did say that that can help to prevent or at least slow down the spread of it. And the other question would be, is what about gloves in public? Is that something that people should be considering? And if so, what's the proper way to use gloves? Because should they be disposed after you're in a store or any single use? Is it a single use for gloves?
That's a great question. I would venture to say Dr. Duckett could probably offer even more insight. It depends on how you're using them. Right?
Okay.
If you go in with the express purpose of picking up your groceries, putting them in your cart, and leaving, you may help prevent you from the wearer from picking up the virus on your skin. And you go home and you carefully remove your gloves. It's all about technique, and then wash your hands really well. You may have helped prevent that, but it doesn't mean that something didn't get on your gloves and you spread it to all those other things you may have touched. So it really depends on how you're going to make use of them. It's not to say you can't use fabric things also and wash them really well and reuse them. But again, it's technique and how you put them on and take them off.
And Dr. Duckett, is that what the information you would provide too? Is that the recommendation of how you would use them? Or do you have other recommendations along with that?
I would certainly say that. You know, there's a lot of discussion in relations to the use of gloves, because, you know, you see a lot of the different even videos out that some healthcare facilities are putting out. I mean, people are, you know, wearing a mask or wearing their mask, wearing gloves, but then when in the store, they're scratching their head. They're not really doing things, you know, touching their face, still rubbing their forehead. You know, the best use of gloves, I guess, in my opinion, would have been, okay, you go into before you go into the store, you put them on, and you're touching all these products that you don't know who touched 5 minutes prior as it is. So your gloves and your products may be infected, correct? And then, you know, you're wearing your gloves, but then maybe when you leave, but then you're opening up your car door. So I guess the point I'm getting at, it's very complicated to wear gloves like, you know, the way you should. This isn't like going into an OR and scrubbing in. You know, a lot of times people think they have the same protection. When you're in an OR, you know, you're really disinfecting your hands to the best of your ability, whatever else, everything has been sterilized around you. You put the gloves on, you do your procedure, and then you're pulling them off and boom, boom, boom. But it's hard to do that in real life, you know, because all the products around you, I mean, I tell people, think everything you touch potentially has COVID-19 on it, because there's a very strong likelihood that it could. So I think people had to be careful of having a false sense of protection, thinking that these gloves are somehow protecting them. It certainly does not replace good hand washing. I think that's been proven time and time again to be the most effective way of preventing the virus spread. But I think some people have a peace of mind of having gloves on, and I can't, I guess, detract from that. But I don't want people to have a false sense of comfort thinking that this is somehow protecting them above and beyond, when it may in fact not at all. So in essence, there isn't very good evidence either way on the use of gloves, in my opinion.
All right. Thank you both for that information. And I think that it will help out our listeners today to make their own decision as to what they think is best for them. Kathleen, my next question is, how long does the virus live on surfaces? Is there a difference also between the type of surface, so plastic, metal, clothing? Do you see that the virus lives longer on certain surfaces other than others?
So that's another great question that does not have a simple answer. So much research is being done on this. So I spoke with our medical director, Dr. Joya, and I did some research myself. It really depends, as you stated, Robert, on the type of surface. A hard surface, the virus may last longer. A warmer arena, the virus may last longer. That's why it's important that we keep areas clean that we can, and utilize appropriate cleaning techniques and cleaning products that have, so for example, a 70% alcohol, or the CDC has a website where they list products that have virucides in them, and clean hard surfaces where you can, frequently touched items and objects like doorknobs and toilet handles. Those areas that we lay our hands on frequently that are more likely to retain a virus if we have it on us. Computer keyboards, you have to be careful, right? Your electronics. So you have to use a product that's appropriate to what you're touching. But fruits and vegetables, we can't say. We should be in a good practice of rinsing them off anyways because of how they were grown, and just to get obvious dirt or debris off something, and then do the best we can.
With the fruit and vegetable, obviously we should be washing them anyways, but a lot of things nowadays lettuce comes triple washed or double washed. Should we still be taking that extra precaution, especially now, to rinse off our salads before we eat them?
It would depend how they were bagged, right, and how they were put together. We might touch the outside of the bag and perhaps there's something on that, but the spinach inside might be just fine. If you have the ability, it is of no harm to rinse your vegetables and fruits again.
All right, sounds good. So the next question I have is the virus is airborne droplet. You mentioned is how it's most commonly spread. I just had a conversation earlier today, and I think there's some misunderstanding about how it's actually spread, and that the social distancing was more to protect us from, say, sneezing or coughing, but that's not quite accurate, right? You could just transmit it through normal conversation. Is that safe to say?
Correct. You don't have to be overtly symptomatic to be transmitting this virus. So when you mention cough or sneeze, allergy season may be picking up for some people, but we want to use good hygiene anyways when we have any sort of a symptom like a cough or a sneeze. But you're absolutely correct, Robert. We could be just in conversation and not realize sometimes that droplets come out of our mouth, and we can be harboring the virus, not know it, and then become symptomatic a few days later. Or some of the research is finding people may harbor the virus and never exhibit any significant symptoms, so never realize that they were ever a carrier. So the best way to move forward is to assume that anyone and everyone can harbor this, and it is in our community, and we have to live more cautiously at this point in time.
All right. I think that's safe to say that hopefully we're all starting to realize how cautious we really need to be. The final question that I have is, there was some information that was given out that said that Cuba County had a D in social distancing. Mm. Now, my understanding is how this rating came about was from a startup company that used cell phone data and put the signals that were being sent out from cell phones to kind of map out where people were and how close in relation they were from it. Not quite sure about the technology on it, but can you give us some information as to why you think that we did receive that D in social distancing?
Well, I'm like you, somewhat taking this with a grain of salt. For one thing, I probably don't understand the technology of how this was measured, as well as many people may. But we are a very long and rural county. So if I'm an essential worker and I'm going to work, and I live in Fairhaven, but I work in Auburn, it may look that I'm traveling more than I ought to. But really, I'm just going to work at the hospital or at the prison or to my job that is considered essential. I think the purpose behind it was to look at, are we making unnecessary and frequent trips to public places? If that's the case, there's some merit to understanding and to cutting back and doing that. That's what we are trying to reduce, our exposures to others and to places. Again, temporarily, because listening to Karen, I really enjoyed her presentation. I would like to think we don't have a D in social distancing, but I also believe that we can do better. And so perhaps that will motivate many of us to take that more to heart and be more deliberate in the choices we're making.
Great point. Great point. That was the last question that I personally had on my list. So I do want to open it up to everybody else that is on this video right now. Does anyone else have any questions for Kathleen? All right, so I think for now we're going to go ahead and move on to Adam. Adam, I have a few questions for you also. The first question is, what do you think could be the worst case scenario for Auburn, Cuyahoga County as far as the number of cases and fatalities that could result from it? I know it's a touchy question that we don't want to put fear into people, but it could be something worth talking about also.
Sure. That's an easy question. No, not really. So, I mean, the reality is this: when we look at numbers, when they ask the CDC, they're putting out national numbers. The number we hear these days is anywhere from 100 to 240,000 deaths. So that's quite a variable number, right? I mean, how do you go from 100,000 to 240,000? I mean, some people were projecting millions. Now, those are a bit far-fetched and have been essentially dispelled by many. And then you have people like Bill Gates, who's had quite a bit of interest in this whole pandemic and in pandemics in general. I mean, even 5 years ago, he was the guy saying that he's more worried of millions of people dying from something like this as opposed to an actual war. So how does that translate to Cuyahoga County? Well, obviously, you really can't say. I mean, if I were to try to predict, I would say that, worst case scenario, I mean, our hospital is filled to the brim. We have people on all the vents and things along those lines. But the reality is, I'm hopeful that we don't see that. I mean, I feel like a lot of us have been sitting here waiting. I mean, this is the time that this week and next week are the time frame where they say we're going to be getting hit hardest. So we're all anxiously waiting, and as I said before, we plan for the worst and hope for the best. So, I mean, right now, I'm actually pretty happy because I haven't seen anybody in our community pass away from this, right? I'm hoping that trend goes through. I mean, if you see that the vast majority of the cases have happened in New York City in terms of deaths and cases in general, right? I mean, maybe it's going to be more so limited down that way. Maybe we were able to get on top of things, of closing down things much sooner. I mean, you have to remember, New York City, I think, has 8.4 million people living in an area that is not that big. So the spread of it is, even if you shut things down, is very, very tough, where, up here, there's a lot of distance between people. So when you shut things down, it's really going to kind of stop this, hopefully dead in its tracks. And to echo what Kathleen was stating, I mean, they're saying that we had a D in social distancing. I don't really know what type of numbers that they were using, because, if I run to the supermarket or whatever else around here in town, the roads always look like they're a Sunday afternoon. I mean, there's not a lot of people out as there was, especially given the fact that the weather is what it is. We've recently had an executive order from the legislator, stopping all people going to playgrounds and such, as that. So, that would help. But I guess getting back to the question that I'm kind of dancing around is that nobody really knows. And anybody that says they do is probably just using things that they are using in their own opinion. And in times like this, I think it's important to say that this could get very bad, assume everybody has it, and assume it's going to be terrible, but don't hope for that. So that way we're prepared. But to throw out numbers, I think, is a bit of fear-mongering in some capacity, right? Especially if I can't say, I anticipate, 54 and a half people of having a really bad go at this. I mean, what are your numbers on? It's just my gut instinct. I'm not going to give that to people because that's not fair. We already know what this can get. We know how bad it can get, right? We've seen it down in New York City. But to say exactly how it's going to hit us, no one's really got those numbers because it hasn't happened yet. We have no precedent, really, because this is a novel virus, new, never been seen, right? We have no precedent to compare it to.
Fair enough. So with the question, you mentioned New York City, and you also mentioned ventilators, and there's always that question about what our ventilator supply would be, and are we seeing that we're needing to send some of those ventilators down to New York City, where it seems to be the epicenter right now for the virus?
I really can't speak on that as much. I think that would be better suited for a representative from the hospital. What I will state is that I have never seen, since I've been in the hospital, so much action and progress in a short amount of time. Expanding their capacities to take care of people in the event that this hits us hard. I think that we've been above the curve in our response with our hospital in that capacity. In terms of what they're actually going to be taking away and potentially bringing down to New York City, I really don't know. But I already do know that they have expanded the capacity significantly in the hospital from what it was a while ago. I guess that I would take the opportunity to kind of do a follow-up on that. A lot of people right now point a lot of fingers. I mean, everyone's wondering, oh, we weren't prepared, we're not prepared, and everybody has an answer as to why hospitals weren't as prepared to begin with. But over the past probably 30 years, we've seen a big change where we've become a very inpatient to outpatient kind of healthcare system. I mean, many, many years ago, if you had pneumonia, you were admitted to the hospital for 2 weeks until you felt better. Now you could be sent home from the ER on an antibiotic. Sometimes if you had a blood clot in your leg, you were admitted and put on all these IV drips and everything else. Now you're sent home 5 minutes after diagnosing it. I mean, if you're stable. So our health system has changed. It's evolved where advancements in care have allowed us to get away from an inpatient predominant service to an outpatient. So anything like this was obviously going to be a hard hit just because, while we still had all these empty rooms, they weren't stocked because we weren't prepared, not prepared in the sense that, everybody was kind of putting their feet up, but they weren't prepared because the system wasn't designed that way anymore. You know what I mean? That's the reason why you see a lot more even outpatient surgeries. Before, surgeries that would only be done in the hospital are now being done, in one-day surgery. So.
Thank you very much for that. That was great information, a way that I personally would not have thought about it, not being in the healthcare industry. So it really shined a lot of light on what's going on and how hospitals are operating. Thank you.
Sure.
So next question with that, you talked about our capacity and you said that, right now we're doing well as far as the hospital and capacity and bringing things up to that. But what is the true capacity? So say worst case scenario, the hospital ended up being completely full, all the rooms are being used, the pandemic hit harder than expected, or just the volume was higher. What other facilities are available, or is there other, makeshift facilities that could be utilized through, say, hotels or other large spaces that could be set up?
Well, I think the big thing to kind of focus in on, and I want to jump back to something Kathleen said, we're taking this day by day. We have some plans and different things in terms of if these worst case scenarios. And again, I'm speaking on more of my own opinion. I would find it very hard pressed that we would fill what the hospital has provided. It's amazing of what they've opened, and maybe a follow-up with the hospital at some point would be a good idea for people to kind of get the official. But if we're supposed to be getting hit hardest now and then next week, I think we're going into it in a very good spot, but that doesn't mean that something doesn't change tomorrow or the next day or the next day. There's a lot of different options that people discuss. Those discussions are being discussed at the levels that they need to be discussed. I'm not privy to some of them, but I do understand that they are talking about it. But I don't know if I really have anything solid to go by. That might be a question that's better answered by the hospital. Mm-hmm. But I will state that their preparedness is extraordinary given the short amount of time that they had to do it.
Fantastic. Well, one final question for you. It's going to be a two-part question.
Yep.
So first part of it is, do we know how the cases in Cuyahoga County were transmitted? So how did, essentially, did the virus come to Cuyahoga County? How were they transmitted? And then also, with the people that it's been transmitted to, how is it that some patients require acute care, but then others have a very mild symptom, may not even realize that they have the virus?
Well, I think it's very difficult to say in terms of how it got here. I mean, who was patient zero? I mean, I don't think we would ever really fully understand that, especially given the idea that a lot of people may have been transmitting this without even having any symptoms at all during their, entire infection.
Mm-hmm.
So I really don't think it's a fair, not a fair question, but I don't think it's an accurate way of me to respond to that. I don't think there's a good way to respond to that. And the second part of your question, could you repeat that one more time?
Yes, some of the patients that are coming in, they're going to require a higher level of care.
Oh yeah, okay, I remember. Okay,
instead of mild.
So why do some people get worse than others? Well, one thing that we have certainly seen is that obviously when you look at the people that are dying, unfortunately, it's the people 65 and older, and I say unfortunately in the sense that these people typically have more health issues going on, right? More comorbidities, as they say. So that's very fearful, and our job is to protect those people as much. But the fact remains that anybody can have it. So you might be young and healthy and have a better chance of passing it, but you can still potentially have a bad outcome, and we're seeing that. I guess one thing that I get a little upset about is that sometimes, especially with social media, we have a lot of people share, those cases, even though they're much fewer, but they still happen. These cases of these young folks getting very sick and passing away. And I think that scares people. And it should. But at the same time, I think people lose fact of or lose sight of the fact that most of the people that are really being stricken hardest are the people that are 65 and older, and people that have multiple health issues, especially, like COPD, smokers and things like that, diabetes uncontrolled, people that have some degree of immunocompromise. But, like I said, anybody can get it, and we have to be cognizant of that.
All right. Thank you very much for that information. Now, that was the questions that I had for today. Does anyone else on the panel have any further questions for Dr. Duckett? All right. So we will move on to Karen. Karen, I just have a couple questions for you. So the first question is, obviously, there's currently a big loss in job within the tourism industry. Do you think, what will the ultimate impact be of that? And do you think some of these jobs will be coming back? Hopefully they will be.
As soon as the stay home is lifted, restaurants will be opening it back up, and attractions will be opening back up. So some of those individuals that will let go will hopefully come back. But it will be a slow transition as the economy starts lifting and more people start visiting. Just like when you open a new restaurant, you might only need one waiter. And as you get busier, you need 2 and 3 and 4 waiters. So I think it'll be a slow transition back, but that's where the support comes in. We need to be there to support the businesses that we truly care about and be those that will help them come back.
All right. And Cuyahoga County has a great communal feel to it. The support that local businesses get in this area is fantastic. So I think that things will pick back up for those restaurants for sure, and any industry that has been hit with that, especially within this community. The second question I have, you mentioned that online shopping is an option for buying merchandise, buying wine, whatever, from local suppliers. What if a small business does not have a online shopping cart set up? Is there anything out there, any resources out there that they would be able to reach out to you or someone else that you know that could help them with that technology, with that setup?
A lot of retailers have gotten creative, and which is one of the ingenuity, beautiful things that come out of this. And they have set up like private shopping hours. If there's something that you really need for a baby shower and you really want to go and pick it up, they have set up like private shopping hours where you can go in and pick something up special. A lot of them are just taking phone calls instead of online shopping. You give them a call ahead and they will through Facebook or with a phone, show you what they have, and then set up a pickup time location. Everybody who accepts credit cards should be able to transition over to taking credit card over the phone with a verbal acceptance. We are promoting and trying to get the information out as much as possible through our online shopping distribution. And get yourself up there. Give us a call. Tell us you have product available that you'd like to be added to the shopping list so that we can help distribute that and promote it through all of our social channels that we have available.
All right. Thank you very much, Karen. That's great news. Hopefully all the businesses that are seeing an impact from this will be able to come out of this stronger with some new ideas about how to handle commerce, and hopefully, God forbid, something was to happen later on, another pandemic or something, we'll be better able to handle at least the commerce part of it.
But I would like to close, Robert, like you said, Cayuga County is an amazingly community-based, you can just feel it and you can see it in what everybody's doing and how they're supporting and how they're calling each other up in the different ingenious ways that they're supporting each other from staying at home. And that will be the first step, the community going out and supporting each other, supporting their friends who have businesses. And so I think we bode better than many other communities around the US. And it is a beautiful thing to be a part of. I'm very proud of that.
As am I, as am I. So is there any other questions that anyone has for Karen? Okay, so that wraps up the first roundtable that we are doing in this new digital format. I appreciate everyone for coming on. I thank you, Kathleen, Adam, and Karen. All the information you provided has been absolutely fantastic. I really do appreciate everyone's time today. I think that this has been very valuable for the roundtable members, and look forward to working on new topics for the upcoming month. So thank you, everyone, for taking time today.
Thank you.
Robert.
All right, goodbye.